We'll come a little bit further after the round of discussions, but I would first like to request Dr. Huong of VMA to give her comments.
Thank you. First of all, I would like to thank WHO in Vietnam and Professor Han from SNU for your collaboration and support in improving water and sanitation in healthcare facilities in Vietnam. Many healthcare facilities in Vietnam are now still lacking reliable drinking water sources, especially in the drought season and under impact of climate change. For example, in 2016, drought and saline intrusion affected 22 provinces of Vietnam, causing shortage of safe drinking water in 17 hospitals and 483 commune health stations. Improving access to safe drinking water is considered a very important factor to watch in healthcare facilities in Vietnam. And in 2016, Minister of Health of Vietnam issued an action plan for implementing green, clean, and beautiful healthcare facility, aiming at improving basic healthcare services through promoting facility environment, waste management, drinking water supply, sanitation, and hygiene. Different interventions for improving safe drinking water supply have been piloted during the implementation. The pilot Rainwater for drinking system in Lý Nhân District Health Center in Vietnam in 2019, conducted by VMA Ministry of Health, WHO, and SNU, is one of the successful interventions. In this pilot project, our agency under the Ministry of Health play a very important role in setting water quality standards, steering, supporting, and monitoring the implementation of local health authorities and district hospitals, and also providing trainings on the waste fit and also water system operation and maintenance. I think replicating the pilot system in other hospitals is no doubt. However, some lessons learned should be taken into account for further implementation. First, rainwater for drinking system should be installed in provinces with high rainfall or with long period of rain per year and lacking of pipe water supply. Second, success of the pilot system depends much on strong commitment from hospital management board and also local health authorities. Third, initial investment for the system is pretty high. Cost effectiveness and applicability for poor healthcare facility should be assessed. Last but not least, separate technical regulation for rainwater for drinking should be developed. So that's all my comments. Thank you.
Thank you very much, Dr. Huong. Very important comments on the situation in Vietnam with respect to services in healthcare facilities and the ways forward to improve the situation. You quote your minister and the intent of the government to do more about including rainwater harvesting based, rainwater for drinking based systems in your healthcare system setup. Very good. This is Vietnam. Now we also have a presentation, or at least a comment from somebody who's working in the South Pacific, Dr. Shin. Can I ask you to take over and give your comments on the experiences you have gained with this process?
Okay.
Dr. Shin? There somewhere. Um, Dr. Shin? Yes. Yes. Okay, good.
Can you hear me?
Yes, very good. Welcome.
Good. Okay, hello. I am Dr. Shin. I am New Zealand resident. I am currently working for the Office of NGO Summit 237, New Zealand. It's my honor and privilege to participate in this panel and speak to you about the experience with the rainwater facility for drinking system in the South Pacific Island nations today. The areas that I'm going to share with you are problems and solution, impact of the rainwater facility for drinking system, and the lessons learned from the experience. Okay. Most of the South Pacific Island nations consist of volcanic islands, which has high levels of lime in groundwater. Therefore, groundwater cannot be used as drinking water, and there are many polluted places. I have done volunteer medical mission services for 5 years now, and I have seen kids drinking dirty water many times. Some water and sewage system in the South Pacific nations do not operate normally, so many people suffer from waterborne diseases because of polluted and unclean water. Foreigners living in the capital city can buy and drink clean water, whereas other local residents who live in a small town and remote areas are barely able to drink clean water due to the lack of knowledge of accessibility of clean drinking water facility, and also lack of understanding and awareness of recognizing how much of an impact drinking polluted water can be on people's health in a negative way. Therefore, I believe this rainwater facility drinking system is essential and needed in the South Pacific Island nations. I heard about cases of Seoul National University's installation of rainwater facility for drinking water while I was pondering about how to solve these water problems in the South Pacific Island nations. And I realized that this rainwater facility for drinking system is a way to ensure water availability in drinking water scarce areas and also to solve drinking water problems. And in 2019, with Professor Han Mu-young, the head of the Center for Rainwater Research of the Seoul National University, Summit 237 set up rainwater facility for drinking in 3 different areas in Vanuatu and in Solomon Islands. First, rainwater facility for drinking system was installed at Herring Kindergarten, an elementary school of Vanuatu. The first picture on the left side. And in the middle, the second water system was installed at Harborside Seafront Park in Port Vila of Vanuatu, where people frequently visit and pass by. And the third one on the right hand, the third one was installed at Robe Health Clinic in Honiara of Solomon Islands. Okay, so let's talk about the successful case. The rainwater facilities for drinking system at Heron Kindergarten, an elementary school in Vanuatu, and at the Robe Health Center in Honiara of Solomon Island have become successful examples, as you can see from the pictures. As you can see, the rainwater facility at Heron Kindergarten, an elementary school in Vanuatu on the left side of the picture, it has been successfully maintained and served as a public well for the locals and residents. The reason why it's been successfully managed and maintained is because a person in charge of managing rainwater facilities was raised to manage and monitor the system and to help local residents, parents, and school students to make a good use of drinking water facilities. The locals and all the school students have been able to access clean water, drinking water, and it seems that the rainwater facility have become very popular and well received in that region. And on the right picture, right side, this is a good example of the rainwater facility in Solomon Islands. It was installed at the Robe Health Center in Solomon Islands, and it has become a successful case. Patients of the clinic, employees, and local residents in that region is utilizing the rainwater facility very well. company officers who helped with installation of the rainwater facility has been working as a management supervisor every week to take care of the rainwater facility. And it is still well maintained and used by people because of that. So we can see that these two places where the rainwater facility for drinking system were set up are making a good use of the system. Okay, let's look at the case of failure then. Um, the two rainwater facilities I mentioned earlier are well maintained. However, the rainwater facility that was installed at Harborside Seafront in Port Vila, Vanuatu seems to have some issues right now. And as we can see from the pictures, there are several parts that need to be fixed and managed. Due to the COVID-19 situation and the national disaster, a person who can supervise and manage the system has not yet been selected. This is the main reason why repair work has not been carried out and been delayed. Okay, so what I learned from this project is, yes, it is important to know who and how to manage and maintain this facility, but planning and having a proper management system is also very important part of the maintenance. Regular maintenance will keep the rainwater facility or drinking system functioning optimally, so it continues to deliver cleaner rainwater to people. And also it is important to educate people and change people's thinking. That's what I learned from the experience. And the last one, I hope more rainwater facility for drinking system to be installed in many different remote areas and difficult regions, such as empty and neglected areas of South Pacific Island nations, so that people can have more access to drink clean water, not only to prevent waterborne diseases, but also to have better quality of healthy life and to leave no one behind. Thank you very much.
Thank you, Dr. Shin. Nice presentation and also showing the needs in the Pacific.